How is autism assessed? I'm a clinical psychologist, and let me break down the 4 main ways that autism is assessed. The first thing is a clinical interview. This goes through a detailed history as to the reason you think you may have autism, your signs, your symptoms, your developmental history, whether you met developmental milestones, and if it's for a child, this is usually done with an adult or a primary caregiver. The second thing is that a trained clinician will then look at behavioral aspects. So they'll have a look at your behavior. This is also known as a mental status exam, where they can get information about your gestures, about how you respond socially. They might observe a child in a play situation. You can also use standardized tools to get this information. Third is cognitive assessments. Now, this is very important because a cognitive assessment, also known as an IQ test, usually known as the Wechsler scales, measures someone's intellectual capacity and their strengths and weaknesses. And this can give you a lot of information as to whether there might also be comorbid learning difficulties, because we know with autism or any type of neurodivergence that there can be comorbid learning disorders. Then we also look at functional assessments. Now, this is basically someone's ability with day-to-day life activities. So things such as the Vineland, that is a type of an assessment to see how people go with daily living skills. And finally, it really is about getting collateral information from parents, teachers, loved ones, and then you'll go through the DSM-5, which is the Diagnostic Manual of Mental Health Disorders. Go through that criteria, but it is a very thorough process because you want to make sure that you've got all the information. Got a question on psychology? Let me know in the comments.